A very, very warm welcome to you. I have to say the Melanoma Patient Conference is an absolute highlight of my year. And it's not just a highlight of my year, it's the team. The whole team are here. There's been slight changes. This is a picture, I'm not showing it. This is a picture from last year. Lucy on the left retired in October and she's come back because she loves it so much to volunteer for this event. And Fiona, our fundraising manager, is on maternity leave, and so we've got the lovely Julia, and we've got Emma, who's replaced Lucy. So the team is here, and a very warm welcome to you. And this could not be done without the team. So a huge thank you to the team, and also a couple of other thank yous, obviously to Imogen. This is a privilege to support you and this conference. To empower patients, a safe space, to see the smiles, to see the hope. This is why we're here to support you. And I've mentioned the team, but also a special thank you to India and Liana from Meet Events who are supporting us this time. Of course, to the speakers and our sponsors, and a little shout out to Mariel who helped us with the sponsor bags. And thank you to Kevin Donaghy, who's also supporting us and with his books outside. Trustee news, I want to just give you a little bit of an update about Melanoma Focus. We've got 5 incredible new trustees to support our body of trustees. There is information about them on our website, and a few of them are here, of our trustees are here today as well. Melanoma Focus, we've got 3 strategies. One of them is to support healthcare professionals. Our second pillar is about supporting patients, and our third pillar is about awareness and advocacy. We have gone and undergoing an interim strategy at the moment where we're just working out and where we're going with additional work and finding out further information. So with part of our patient strategy, you will be hearing from us. We'll be surveying our membership, and that's really to get your feedback, surveying patients, to really get feedback about our services, about the information we're providing. It's really important we listen to you. And we will be creating a more formal patient advisory group. We've got information on our website about support groups. I just wanted to mention that, but also do tell us if there's any support groups you know about. We've heard a lot this morning about clinical trials and about information, and I know it was a lot of information to take in. So just to reiterate, that is all being recorded, and the information will be there for you. But just to let you know, on our website, we are PIVTIC accredited, so we are a trusted patient information provider. We take that very, very seriously. And that's just to give you some of the criteria that we're assessed against. Immunotherapies was spoken a lot about this morning, and one of the areas that we've advanced on our website is information about immunotherapies, which we spoke about last year, but there's several additional pages about the side effects. It's complex. So just so that you've got that understanding, or a better understanding of the potential side effects. It's not to say everyone will get side effects, but it's just so that you're aware of the potential side effects of immunotherapies. And with that, the guidelines were mentioned this morning, the mucosal guidelines. So that consultation, you'll hear about that from us. We'll send it out in a newsletter next week because we do want feedback. So Miranda mentions that's going out to wide stakeholders. So that will be going to everyone on newsletter, and it'll come out to you. And then there's other guidelines that we're working on at the moment with a wider group of dermatologists, oncologists, patients. And that's really to support anyone who's having immunotherapies. It's wider than melanoma, but we're supporting this process so that specifically about skin toxicity. So that's guidelines, again, for clinicians, but also for patients. And I just want to also shout out about the trial finder that was mentioned by Heather. The idea of the trial finder is to empower you so that you have a good understanding of what trials are available in the UK. We keep that up to date. Nikita is our research officer, and she liaises with sponsors, with chief investigators of trials, and that's to make sure that we have an accurate picture of which trials are open, which sites are open across the UK. Trials are explained. They're not there in complex terms for you. And we do ask for feedback when we're putting the information on the website to make sure that that does make sense to you. So that is a resource for you to empower you to understand what trials are available for you to discuss with your medical teams. Research funding. We do fund research projects for patient benefit, and you'll be hearing shortly about the second project here. These are two projects we funded last year. May is Melanoma Awareness Month, so we will have a lot of resources for you to share with your, well, wherever you wish to share or use, digital screens, posters. We've got them in English and Welsh, and they're readily downloadable on our website, or we can send them to you as well. And we're hoping to make a bit of a splash this year as well with Melanoma Awareness Month. And I just wanted to give a shout out to Charlotte, and you'll be hearing from her shortly. But we'll be doing some specific work, some pilot work in Sheffield as well. Sheffield's the outdoor city. And so we're working with Charlotte, the medical team, and Western Park Charity, and then Skinner additionally doing some work with primary schools. Last year, we commissioned a report about VAT on sunscreens. There is VAT on all sunscreens. And so we, with our data in 2023, our survey data showed that 10 to 15% of people couldn't afford sunscreens. And you're talking about melanoma, which is a cancer, which is preventable in nearly 9 in 10 cases. And therefore, this led us to commission a VAT piece looking at sunscreens. And so this showed that we could save the NHS 128 million annually on treatment costs and potentially lives. So this is something as part of our advocacy work that we hope to, working with joint stakeholders, but we're trying to, there's a new government obviously, so it's working, we're sort of dealing with lots of different stakeholders, but also responding to the various plans, so the NHS plan and the cancer plan. And just wanted to flag 3 podcasts that we created with ITM Business as well. Supporters, so we can't do this without your help, so I just wanted to shout out as well. Julia is outside, so there's many ways you can support us. And we have just started as well a joint fundraiser with Skin, 100 Miles in May, and there's obviously many, many other ways, so thank you.